So yesterday I got a health safety notification from a mail-away pharmacy, which isn't unusual. This is a pretty routine safety net. Pharmacy will reach out because the automated system flags that the patient is on a medication contraindicated, either because of her medical history they have on record or because she's on a different medication, which it may be contraindicated to be on both at the same time. But this specific notification was surprising to me because it was a patient who was on two medications, which I was aware of, both of which are extremely common to be on at the same time. One was a normal low-dose birth control pill and the other was an SSRI, which is a mood stabilizer for her history of depression and anxiety. And it took me by surprise because although I'm aware that there is literature that's out there, most of the time these automated flags are based on literature that may be recorded. There's much more literature and much better studies to prove that being on an SSRI and a birth control pill is not a contraindication. The reason why these notifications are starting, I believe, is because of the most recent studies. Danish study, and then there was one in Sweden, shows that there's an increased risk of developing depression after starting a birth control pill, specifically in younger patients and teenage patients, and specifically within the first 2 years of starting a birth control pill. However, if you've read these studies, you would know that these are not randomized controlled studies. While they are large studies, they are only cohort population-based studies. And there have been randomized controlled studies which have proven that there is no definitive link between developing depression and starting a birth control pill. So it just made me a little bit nervous that this is now a red flag in the automated system because it's an AI-driven thing. And now doctors or nurse practitioners who see these kind of notifications, they're not going to actually research and do the work that's necessary to figure out if this is actually a serious concern, which it may be. There are maybe some people who are at increased risk of developing depression from birth control pill. But on the flip side, there are a lot of patients who benefit from the birth control pill specifically because of their depression and anxiety. It helps to control it, specifically when it is hormonal, when it's cyclical. There are certain classes of birth control pills that are approved for PMDD for this reason. So it would really be a terrible thing if these doctors and nurse practitioners would suddenly just stop prescribing these medications to patients who really could benefit from it because of their depression and anxiety, because of their mood concern. That would be a huge detriment to these patients. This is why AI may be effective, but it's pulling data and information from places where doctors are still obligated to apply clinical judgment and not make rash decisions based on what AI is telling them. Anyways, AI may be the future, but there's still going to be kinks for a long time. And human doctors, for these kind of reasons, will definitely be necessary. Safeguard against issues like that.